It's just gone 7 o'clock. Hello and welcome. You're watching SA Tonight on eNCA. I'm Marcel Gordon. These are your headlines. The City of Tshwane has been granted a permanent interdict against striking workers. Some city employees have not been on duty for several weeks. The body of former IFP leader Prince Mangosuthu Buthelezi has arrived at his home in Ulundi. His funeral is being held tomorrow. And some SASSA grant recipients say they're still unable to access their funds after a glitch in the system hampered payments. The Labour Court has granted a permanent interdict against striking City of Tshwane workers, ordering SAMU-affiliated workers to go back to work. The city approached the court on an urgent basis as the strike had been ongoing for 7 weeks. Workers wanted a 5.4% pay increase, but the city maintains the hike is unaffordable. But earlier this week, the local government bargaining council ordered the city to immediately honour the collective agreement to grant workers increase, which was agreed upon in 2021. The city is appealing that ruling. Now, the Competitions Commission is investigating Johnson & Johnson for alleged price gouging of tuberculosis treatments. South Africa has one of the highest TB rates in the world, and it's the country's top killer. In 2018, the Health Department started to give bedaquiline to everyone who needed it in the public health sector. Let's find out more about this specific case from Candice Sehoma from the Doctors Without Borders organization, and she joins us virtually from Johannesburg. Candice, thank you so much for your time. For those who perhaps are coming to terms with the story and perhaps getting confused by all the lingo being used here, specifically for this drug pertaining to tuberculosis treatment, what are we dealing with here? What do we know about this specific tuberculosis drug?
So thank you so much for having me. So as you rightfully mentioned, we have been advocating as civil society for access to bedaquiline, which is a DRTB drug. So it's a drug-resistant TB. So it's not, there is specific treatment for the normal TB, but if you do get some kind of resistance, then you would require to use bedaquiline. And, bedaquiline is quite an innovative drug. It's an effective drug compared to previous or old TB medicine. It's also a very short-term regimen. So previously, TB patients would be subjected to using or rather getting treatment for like 20 months. This treatment is for 6 months, and it's the most effective. And I think with old TB drugs, they would have some toxic side effects. This particular drug does not have that. So it's known to be like the backbone, basically, of treating TB. And we have been advocating for access to bedaquiline for many years to today.
And from what I understand, over years of being in conversation with especially community health workers at ground level in South Africa, the big issue or challenge when it comes to treating those suffering from tuberculosis is ensuring that week in, week out, or month in and month out, they go to the clinic to get their medication and that they're taking that medication every day. So by the sounds of it, this bedaquiline, if I'm pronouncing it correctly, was a real game changer, wasn't it? Tell us what kind of impact it's had, because now we understand in terms of pricing, as things stand, South Africa would be paying more than double the price for bedaquiline when compared to many of the other countries purchasing this exact same drug. What kind of impact has that had?
Exactly, and I think one of the things that we are highlighting in this case is that South Africa is actually paying so much more. So at the moment, we are paying plus minus 5,500 for this particular drug, versus other countries that are paying half that price. And this is due to patent monopoly. So Johnson & Johnson is the producer, or the sole originator of this drug, and they've patented this drug until 2027, meaning we won't have any generics, we won't have any generic company coming into the market to supply South Africa. So we solely depended on Johnson & Johnson. And that's why they're able to actually charge as much as they do to South Africa versus other countries. So it's been a huge challenge because now you want to, I think South Africa is a high TB burden country. And, one of the challenges is actually upscaling the treatment to ensure that everyone is able to access it. We've been, facing or confronted with, fiscal constraints. The health budget has been cut. So there's so many limitations that come into play. And now we actually have to pay so much, for treating TB patients. I think that in itself comes into, it brings a big challenge even for the government to be able to upscale the treatment to ensure that everyone who needs bedaquiline is able to get it. So our fight is that we need Johnson & Johnson to bring down the price, to have the price that they are actually supplying it to other countries. Because, I think also considering that we've contributed so much to the development of bedaquiline. So it wasn't just Johnson & Johnson using their investment to develop this drug. It was also public money, particularly US taxpayer money, but also in South Africa, we played a huge role to ensure or to prove the efficacy of this particular drug through clinical trials. And we believe that that should be accounted for. There should be some kind of a benefit that we are able to gain from, our contributions to prove or generate evidence about the efficacy of this particular drug.
Candice, is this another example of an antiquated patenting system that's part and parcel of the modern pharmaceutical world that's really holding health systems, especially in developing countries, to ransom?
Yes, unfortunately, it's a similar issue we have seen with access to ARVs, even with COVID. It's due to our current patent system that allows pharmaceuticals to get away with such practices. And I think what would be very important for us as South Africa is to be able to change our patent laws. So currently our patent laws need to be reformed. They need to have provisions that safeguard public health. At this point, they ring fence pharmaceuticals, and hence they're able to get away with these practices. And hence we're actually experiencing these challenges with every, or rather most medicine, even with cancer medicine. Pharmaceuticals are able to skyrocket prices because, the current law framework allows for them to do so.
You use, I saw a quote from you in an article in Business Live today about it, and you used the term enraged. We are enraged to witness that J&J prioritizes profit over the needs of the most vulnerable populations in a country with a high burden of drug-resistant TB. Do you think enough people are enraged about this? Do you think the health department has stood their ground or come out strong enough against this? And what are you hoping will come out of this newly publicized Competition Commission investigation?
I don't think as South Africa we are enraged enough. I don't think we are enraged enough because, as I mentioned, we actually saw this with COVID. We struggled to get access to vaccines. And it's exactly the same system that actually prevented us from getting access to vaccines because, pharmaceuticals are able to patent their products and get away with all kinds of practices that are not beneficial to us as a South African population. And I think looking at the fact that we went on a global stage to call for patent waivers to allow for us, South Africa, to manufacture vaccines at the time during COVID. But at the same time, we are not doing anything to change even our patent laws in South Africa to ensure that, we are able to get access to medicine. So I feel like we are not enraged enough because if we were, that change would have happened during COVID and in COVID in the face of a huge crisis where we lost so many lives. And yet till today, we still don't have that change happening. So I think with this probe by the Competition Commission, it really does present an opportunity because not only will they look at the excessive pricing of bedaquiline, but they will also look at the exclusionary practices of pharmaceuticals by protecting or using patents to exclude others from entering and supplying cheaper medicine or affordable medicines rather. So I think this particular investigation by the Competition Commission will be historical because of what it's actually looking at. But also I think, looking at the systemic issues, I think that's one thing that we need to do. And I believe this really presents an opportunity to look at these issues more systematically, that we do not have to fight drug by drug. disease by disease, that we need to have an a comprehensive system that allows for that protects public health instead of pharmaceuticals and their profiteering.
Okay, we can only hope that the wheels of that investigation move faster. Thank you so much for your time and your insight. Candice Sehoma is from Doctors Without Borders, joining us virtually from here in Johannesburg. We thank her for her time.